Hi, everyone. Happy Nurses Week. We are here with another video series introducing you to nurses from various departments across MedStar Health Home Care. I'm Carrie Koenig, Vice President of Patient Experience and Communication, and I'm here today with two very special guests who I'm going to ask to introduce themselves to you. Lynette, would you mind going first?
Yes, so I'm Lynette Gosa. I'm the Clinical Training Specialist for MedStar Health Home Care. I'm the other word, educator.
And you specifically work with clinicians in the Suburban Maryland Agency, right?
No, that's not right anymore.
Oh.
Well, all of Suburban Maryland and Virginia.
Okay, great. And Diane, would you
Hello.
introduce yourself?
I'm Diane Rafferty, and I'm a quality specialist. I review charts primarily for the purple and blue team, but I might work with any team if asked.
And how long have you been a nurse, Diane?
Oh, goodness. Since 86.
You're gonna make me do math now?
No, 40 some years.
That's great. And what can you tell us? Do you remember what made you become a nurse?
My sister made me become a nurse. She loved it. She was a labor and delivery nurse for many, many years and was convinced it was the best profession ever. I had graduated from school with a different degree and was floundering a little bit, and she marched me off to nursing school.
Wow. So tell us, in your quality review position now, how do you think your past experience in nursing and your nursing education helps you in your current role?
Well, I think to be a good QA nurse, you need a real breadth of experience. Education is important, but really the experience of, I've worked mostly in post-acute care, in rehabilitation with brain injured and spinal cord injured patients. And it all comes back.
Okay. Lynette, how about you? How long have you been a nurse?
I've been a nurse since 1984, and to do the math for you, it's 38 years, and I've been in home care for 29 years. So.
Wow. And tell us, what made you choose home care? Why have you been in home care for so long?
Well, home care was just something like I had been in the hospital for 10 years and I just didn't like the running from room to room. And when I talked to some of my friends and they were doing home care, they told me, well, here you get to spend time with one patient at a time and you have a little more autonomy. So I tried it, I loved it, and I've been here ever since.
And how do you use your past nursing experience in your clinical educator role?
So in the hospital, of course, I felt like I worked at Greater Southeast and I was getting a lot of gunshot wounds and all kinds of things. So I felt like I took all of the stuff that I learned there and I brought it with me. But I can tell you that in home care, I learned a lot here because LVADs and wound vacs and stuff like that, we didn't do that in the hospital on the floor. So I've learned all of that from being out in the field, and then I'm constantly growing and researching, and and so I love education. I love to teach, and I'm told that I'm very patient. So no matter who comes to us, I have the patience to work with them.
I would definitely agree with that. Tell us, I think a lot of nurses really feel like it defines who they are. At least that's my experience with some of the nurses I know. How do you see yourself as a nurse playing out in your everyday life? Do you feel like it's something that defines who you are?
Are you talking to me?
I am, yes.
Okay, yes. So I'm the caregiver. I'm the caregiver at home. I'm the caregiver all over the nation for every family member. And so I'm the person they go to. And so that carries on and it carries over into what I do in home care as being a caregiver, being a nurse. It's who I am. It gives me purpose.
Diane, how about you? Do you feel like that? Your nursing experience and your nursing career defines who you are in your normal everyday life?
I see it is when you're a nurse, you meet a lot of people from a lot of walks of life. You meet people in their worst moments. You meet people and have meaningful conversations with people you have nothing in common with at all. And I think you don't see people you can't stay in a bubble and just be with people like you. It really broadens your horizon, and that I think will stay with me forever. The ability to step into somebody else's shoes for a little while.
I can see that, especially in home care, right? It seems like nurses in home
absolutely.
care really do have to understand people in their environment. And I hear that a lot, that's why nurses choose home care, because it's challenging. Like Lynette said, you get a lot of different experience. You're not just seeing one type of patient, but then you're also meeting people where they are in their own home environment, and you have to be creative in your care plan.
Yes.
Correct.
Yes, so true.
So Diane, what would you say if I asked you, what's one thing that you wish people knew or understood about nurses that you don't think they understand? What would you say that is?
That nurses in general, that we really care that people get well, that we're not just here for the hour or for the shift or the week, that we really hope that we give you something that will help you in your life going forward.
Lynette, same question. What do you wish people knew or understood about nurses that you don't think they do?
I don't think that they know that we really do care. We treat our patients like we want our family members to be treated. And so we really do want to make sure that this is a lifelong change and that they will thrive and have best outcomes based on the things that we do.
That's great. Well, thank you, Lynette and Diane, for meeting with me today and giving us perspective about your roles in clinical education and in quality. It's wonderful that we have nurses who are giving their great knowledge and experience to so many different departments across MedStar Health Home Care. And we wanted to be able to spotlight 2 of those departments today. So I really appreciate your time.
Thank you.
Carrie.
All right. Thanks everyone for watching. We look forward to seeing you in the next Nursing Spotlight. Take care. Happy Nurses Week.